Hi everybody, welcome back to my channel. I'm Dr. Joanna Savarese, neuropsychologist and clinical psychologist. Today I'm going to be talking about who is a neuropsychologist and what does a neuropsychologist actually do. A neuropsychologist is a professional in the field of psychology who specializes in understanding the relationships between the brain and behavior. Most of the time, neuropsychologists really focus on assessing, diagnosing, and treating individuals with various neurological and psychological conditions that affect both cognitive and emotional functioning. So, in order to obtain a degree as a neuropsychologist, you actually are considered a clinical neuropsychologist. So, most neuropsychologists are clinical psychologists who have obtained a doctoral degree, either a PhD or a PsyD, in clinical psychology, who have specialized in neuropsychology. So, in order to specialize in neuropsychology, most neuropsychologists have what we call a formal internship. Typically, that is an APA accredited internship, and or they have a 2-year fellowship specialization in neuropsychology. So neuropsychologists can obtain their training in medical hospitals, private practice, inpatient units, rehab centers, and various other medical-related facilities. So what differentiates a neuropsychologist from a clinical psychologist is that neuropsychologists spend the majority of their time conducting assessments and evaluations. So assessments typically are conducted in a comprehensive way to assess cognitive abilities, memory, attention, language, motor skills, and emotional functioning. Oftentimes neuropsychologists, and most of the time neuropsychologists, are using standardized procedures to conduct their evaluations, standardized procedures and standardized protocols to conduct their evaluations. Neuropsychologists also focus specifically on diagnosis. Neuropsychologists identify and diagnose different types of neurological conditions, brain injuries, learning disorders, and other disorders that impact cognitive and emotional functioning. For example, dementia, Alzheimer's disease, and ADHD. Typically, neuropsychologists are used as a consult service. This means that providers refer clients to neuropsychologists to conduct an evaluation and to help diagnose specific conditions. Oftentimes, neuropsychologists are used as a consult service so that they can collaborate with other healthcare professionals, such as neurologists, psychiatrists, and rehabilitation specialists to develop treatment plans tailored to address the cognitive emotional challenges that they found in the evaluation. Neuropsychologists don't only do clinical work, they also can teach. So as a neuropsychologist with a PhD or a PsyD, you can teach in doctoral programs, you can teach in undergraduate colleges, graduate school. So oftentimes a neuropsychologist may engage in teaching and also research. If opening up a private practice isn't your thing, or being a university professor is not interesting to you, a neuropsychologist can also work in hospitals and rehabilitation centers. So if you're wondering if you need a neuropsychologist, here are the people that typically refer for a neuropsychological assessment. Individuals with neurological conditions, so this includes neurological disorders, epilepsy, traumatic brain injury, multiple sclerosis, Parkinson's, any type of neurodegenerative disorder, including dementia and Alzheimer's. So these individuals might seek a neuropsychological evaluation to better understand the impact of these disorders on their cognitive functioning. So my specific specialty is in the assessment of autism, ADHD, and learning disorders. So individuals who may think that they have autism, ADHD, or learning disorders often come in for an evaluation to assess their overall learning, challenges with attention, executive functioning, memory, and overall academic and functional challenges. These types of neuropsychological evaluations can help identify specific cognitive strengths and weaknesses and aid in differential diagnosis. So a neuropsychological assessment, or individuals who come see a neuropsychologist, really range in the lifespan. So in my specific clinic, we see individuals from 18 months old all the way up to 100. Individuals with certain psychiatric conditions also might seek a neuropsychological assessment. So for example, individuals who are having any kind of neurological changes or change in functional status, who have diagnosis of schizophrenia, bipolar disorder, depression, A neuropsychological evaluation can assist in helping them understand their strengths and weaknesses as well. Lastly, another group of individuals who seek out neuropsychological assessment is individuals engaging in pre-surgical assessments. So before certain medical procedures, for example, brain surgery or bariatric surgery, some individuals might need to undergo a neuropsychological evaluation to establish baseline cognitive functioning and to also predict post-surgical outcomes. Hopefully you have a better understanding of what a neuropsychologist is and how to obtain a degree in clinical psychology with a specialization in neuropsychology. As always, thank you for watching my video. If you have any questions or comments, please feel free to reach out to me directly. I've also included links in the description below that talk more about neuropsychologists. Thank you for watching.